All right, let's get to it. Transformational revolution resulting in a revolutionary transformation. Oh, before I tell you, I want to apologize. I was supposed to be here at the Las Vegas meeting, but I had a little bit of trouble, got hit with a flesh-eating bacteria. But God ain't done with me yet. So he told me I have to teach you guys how to do the things that I do. And that's what I'm going to do today, because I'm not going to be doing this all by myself long term. So I'm going to teach you exactly what I do and show you exactly what I do so that you can do this on Monday morning if you decide to do it. You can send them to me, but okay. All right. Transformational revolution, resulting in a revolutionary transformation. Wisdom is the principal thing, therefore get wisdom. But with all that you get understanding. That's I believe in that wholeheartedly. That's from King Solomon, the wisest man who's ever lived. I believe in God, and God gives me the wisdom and the knowledge and the understanding to do the things that you're about to see be done. The problem is not that people are uneducated. The problem is that they are educated just enough to believe what they've been taught and not educated enough to question what they've been taught. How many of us over the years, I grew up in dental school, mercury fillings were the thing. We never questioned it. So we have to always ask the question. Always, always, always question it. No matter what I say today, you question what I do. Make sure you have the right answers. So I'm going to teach you about Tourette syndrome today, and then I'll show you how to do it. There's the medical approach, and then there's the clinical dental approach. Conventional wisdom versus unconventional wisdom. There's the clinical research and the true cause of the syndrome, and what people say who have had the symptoms and what they're saying about the method. So what if there is a different way to do what we do? Well, how can we get rid of Tourette syndrome? Have people know what Tourette syndrome is? Yes? No? Yes, good. All right. Here's a young man that came to my office from Texas. This is a video. Let's see if this works. I'm going to let you take a look here.
This is Alex, and well, tell them how old you are. And
I'm 11.
Oh, okay, so I guess I'll talk. So Alex is 11, and he's had a wide variety of tics since he was probably, 5 years old or so. They vary in severity, of course. He tends to have a lot of vocal tics, a lot of head jerking and eye rolling. So we've been struggling with it for several years, and we've tried just about everything with the exception of medication. We've tried exercises, and we've been to lots of different doctors, but to no avail. So we came to see Dr. Sims, and he talked to us about the nerve at the back of the jaw that is compressed and can create tics, of course. And so, as you can see, his tics get pretty high. So we were, of course, ready to try something different, especially since at some point you just don't know what to do. True? I know that the tics sometimes hurt, and when they're high, they can get to be pretty debilitating. As you can see, Alex's tics right now are kind of ratcheted up. Sometimes they're lower, but right now they're fairly strong, actually. So tell them about the device. What do you think of the device when you put it in? Don't put it in yet, but what do you think about it? How does
it feels good, and it takes away my tics, and if not 100%, it decreases the amount and makes them lighter. So, yeah.
How long have you had it?
Since I was like 2 or 3.
Okay. And how many doctors have you seen?
Like
So,
3.
no, more than that. We've seen more. In the last few years, we've seen several. We've talked to the neurologist. We've talked to chiropractic neurologists. We've seen homeopathic doctors. We've researched. We've done dietary changes, eliminating gluten, eliminating dairy. We've done supplements, vitamins, everything. Vitamin D increase. We did the whole gamut. We've tried everything, and nothing has had any remarkable or lasting effect on him. And unfortunately, as he's gotten older, the tics have gotten stronger and more invasive. And he's had to deal with varying levels of bullying and problems in school, and sometimes it makes it very difficult for him to focus because he gets tired from ticking so much. This year has been particularly challenging, which is why we decided to try something different. And we read quite a bit before we came over here, and part of it is a leap of faith every time you try something different. But we've been pretty amazed. Faith is always strong, right? Anything you want to tell someone? Anyone who out there who maybe thinks that
Call Dr. Sims. The ends.
he's a good man. You are a good, kind man, a good soul.
Thank you.
You are a good soul, and he is unassuming and very patient and very kind, and apparently very, very smart. And shall we try putting in the device so you can see the difference? So you want to show them what the device looks like? It's kind of a funny looking little thing, but it has little, I guess, the little pins to hold it in place, and it's just a little appliance that goes in, and it adds space.
Feels good.
And that's
It's great.
And that's huge. That part's the huge part. There's nothing to say.
That's good. That's good. So what would you tell everybody else?
First of all, go to Dr. Sims. Second of all, he's awesome. Third of all, this feels really good. So
There you go.
And it helps with OCD, all sorts of stuff. But yeah,
It works. It works.
It works.
it does.
It works. It works. No side effects, huh?
No side effects. Yes.
Tourette's tick me off sometimes, but this works.
What was your thing?
No, Tourette's tick me off.
Tourette's ticks you off. That's right. Now you can.
That was my Alex. And we've even treated his brother who had this, the same thing. Let's get to Tourette syndrome. It's an inherited neurological disorder that is a chronic idiopathic syndrome characterized by presence of multimotor and vocal tics that have their beginning before adulthood, usually with the onset in childhood between the ages of 5 and 9, and often accompanied by a variety of comorbidities such as attention deficit hyperactive disorder, ADHD, obsessive compulsive disorder, poor impulse control, and other behavioral disorders. The term movement disorders refers to a group of nervous neurological conditions that cause abnormal increase or decreased movements, which may be voluntary or involuntary. Tics are repetitive, stereotypic, phonetic, non-rhythmic, and involuntary. Now, there's a quiz after this, so I want you to memorize this slide here, okay? But some of the symptoms are blinking, coughing, shoulder shrugging, sniffling, neck stretching, throat clearing, facial distortions. This is the slide I want you to memorize. There's complex tics and motor tics, simple tics, such as eyebrow raising or blinking. Complex tics is they're jumping, spinning, clapping, and finger tapping, dystonic tics. You have what A lot of people call Tourette syndrome as the cursing disorder. Coprolalia, where they use words such as swearing words. They even actually have also echolalia, which is repeating other people's words. But the thing is, it's only in about 10% of the 1 out of 10 that actually have coprolalia. What is so interesting is that the Japanese patients who have Tourette syndrome don't have the coprolalia. What does that mean? They don't use those words as often. Tics are preceded by what they call an urge, a sensation that it's telling them that the tic is about to come about. It is called a premonitory urge. That's the fancy name for it, premonitory urge. Tourette syndrome cases are normal intelligence, normal expectancy, occurs in 2% of school-aged children, usually from 6 to 17 years old, even 5-year-olds, transient in 3 to 15% of cases, and decrease in adolescents. So some of the disabilities, severe movements, of course, vocalization. They don't do very well in social settings, and they have attention deficit hyperactive disorder, ADHD, OCD, and anxiety, depression, enuresis. We know where the enuresis comes from. Yes? You guys are smart. You guys are the greatest neurologists in the world, and you don't know it. The greatest neurologists in the world. Sleep disorders, you know where that comes from. Yes, no. Males are affected 5 times more than women. The symptoms there's no set diagnosis. They're observed by the parents and then observed by the neurologists. There are no lab tests that can detect Tourette syndrome. MRIs or CT scans cannot detect any certain, or blood tests can determine tics and tic disorder. They're promoted by the CDC, the NIH, and all the other alphabet soup organizations as no known origin. They believe it's an inherited or genetic factor, SLCTRAC1, chromosome 22q11, 18q22. I talked to one of the researchers who did the SLCTRAC1, and they told me they spent $80 million trying to find this genetic factor, and they couldn't. They could have gave me the money. I'd have been happy. I'd have been real happy. I could have told them, no, it's not there. Then you have pandas and pans, pediatric autoimmune neuropsychiatric disorders associated with streptococcus. They believed that it was associated with a streptococcal infection. So what they did was they gave a lot of, when they started having these symptoms, they gave them some antibiotics. Didn't stop the problem. They said, okay, maybe before it starts, let's give them some antibiotics. Didn't solve the problem. So the pandas went by the wayside, and what they did was they put it under a new syndrome called pediatric acute onset neuropsychiatric syndrome. So the pandas became PANS, and they still don't work. They promoted, they believed they had environmental factors, smoking, stress, low birth weight. Now, you tell me a 5-year-old that smokes. Come on, tell me, you know. The NIH, this is right off their website, it says there is, quote unquote, no cure for Tourette syndrome. The condition many individuals improve in the late teens and the early 20s. Okay, now the video you just saw, does that dispute that their notion that there is no cure? I won't say it's a cure, it's a, because I'll get in trouble. But I'll say there is a way to decrease the amount of Tourette syndrome. Etiology, interpreted as a result of effective suppression of a mechanism in the basal ganglia. They believe everything is in the basal ganglia. Everything, all these movements come from the basal ganglia. What did I tell you earlier? You question everything that they tell you. So I asked the neurologist, top neurologist at NIH. I said, where in the, because I sit with these guys sometimes. I get a free meal. But anyway, I asked them, I said, where in the basal ganglia is the problem? We don't know. So how do you know it's there in the first place? Well, that's where we believe that these movements come from. But if you can't find a deficit, how do you know it's not in some other place? Well, we just want to believe that this is the area. Question what they tell you. Don't believe everything they tell you. Then they have drug therapy for the treatments. Drug therapy, behavioral therapy, and surgical intervention such as deep brain stimulation. Haldol is one of the ones, one of the medications used to treat schizophrenia. My child at 5 years old is a schizophrenic. How many want to admit that? No. He's having a problem. Now, if I gave my child Haldol, these in red are your side effects. Now, do you want your child to have the tics or have all these side effects? I'd rather see the tics. They too would rather have the tics and all these sleep problems and restlessness, anxiety, skin rash, mood changes, breast enlargement. Oh my gosh! On a 10-year-old young man, they're going to have breast enlargement. I don't think he goes to school. Primazide, which is another form of Haldol. Seizures. You're going to have your child, rather have your child go through seizures. I don't think so. Twitching and uncontrolled movements. Didn't they have that in the first place? So why would you want to give a medicine that makes it even worse? Risperidol, also for schizophrenia. Okay? Dopamine transmitter. Again, all these side effects. Clonidine or Catapres. It is a decreased the motor tone and the heart rate. Again, all the side effects that go with it. Not a very good treatment protocol, I don't think. Klonopin, benzodiazepine, affects chemicals in the brain that become unbalanced and cause anxiety. Again, they use it for seizures and panic disorders, suppresses muscle contraction. Another set of side effects. Nicotine. This is the one that actually got me. They were promoting nicotine in Germany as a medicine for the Tourette syndrome. Now you're going to put a nicotine patch on a 6-year-old. How many are going to do that? I want to see the hands. And I didn't think so. But that really kind of bugged me. And here it is, all these symptoms. So you question. They say, it works a little bit. So you ask them, what is the reduction in the amount of tics? They can't tell you. They say, a little bit. What's a little bit? Botulism toxin, okay? Botulinum toxin is to suppress the muscles. Muscles are made so that you bring one bone to another bone or away from another bone. Okay? How many are going to give a 9-year-old, a 10-year-old, all these, who has multiple ticks, all these shots of botulism toxin? How many times do you think that kid's gonna, through botulism toxin? I don't think so. After the first one, he's never gonna go back. Again, all the side effects that can be created by botulism toxin. Now they have this thing called CBIT, Comprehensive Behavioral Therapy, or Behavioral Intervention, I'm sorry, for ticks, CBIT. Now this is the way CBIT works. I'm gonna put this down for 1 second. All right? They're trying to tell you that it's mind over matter. If I have a tick, all right, I want to raise my right hand. That's my tick. Okay? But what CBIT wants you to do is when you feel that premonitory urge, as I told you before, that you want to raise your right hand, do a competing tick. Put your right hand in your pocket and raise your left hand. So I'm doing this. Instead of doing this, I'm doing this. Don't I look like Saturday Night Fever? No. No, it does not work. Plus, the urge is still there. The kids will tell you the urge is still there. Make changes during the day. The standard is 8 sessions at, I think it's like $700 a session. Nope. I don't think so. And you're doing the Saturday Night Fever thing? No, I don't think so. 52% of the children, 9 through 17, say that they had some improvement as compared to 18% receiving controlled treatment. Question. What about the ages from 5 to 9? How many 5-year-olds are going to go and they're going to think about doing it all day long? No. Or a competing tick, raise my left leg, raise my right leg, and then instead raise my left leg. So I'm, as a 5-year-old, 6-year-old, how many kids are going to get bullied and talked about? A lot. Question. What about those who have ADHD? Does it control the ADHD? No, it doesn't. Or the OCD? No, it doesn't. What constitutes an improvement? They don't give you an answer. Okay? Instead of doing this 4 times, they do it 3 times. That's an improvement. That's how they consider it. It's an improvement. The other is deep brain stimulation surgery, which is where they put electrodes into the brain. You put electrodes into the subthalamic nuclei, run a wire through the scalp, down the neck, into a battery pack, or they want to call it a pacemaker, in the chest. They put in 2 weeks later, and then after they've done all that, they have to, like a radio, fine-tune it so that it can reduce the amount of ticks. That only works about 40% of the time, and you still have to take medication. What good does that, what sense does that make? How many are going to have their young person, 9 years old, 10 years old, do brain surgery on them? I don't think so. Not my child. These are some of the adverse effects of the deep brain stimulation: confusion, seizures, infection, hemorrhage. No, thank you. What if there's another way? Have you ever considered dentistry? No, we're not considered for anything. No. Etiology. The cause of Tourette syndrome is unknown, but emerging structural evidential components of Tourette's may be a compressed or irritated cranial nerve. Okay? The official cause, the two events that are shown in 90% of Tourette syndrome cases. The auriculotemporal nerve is most posterior and superiorly distal to the mandibular condyle. The auriculotemporal nerve is a portion of what nerve? Trigeminal nerve, portion of the. So distalization of the mandible causes an entrapment due to insufficient growth of the maxilla, growth in the condylar neck area and growth of the condylar area in the mandible. So as you can see, the yellow line is the auriculotemporal nerve. You can see the condyle is right in front of it. Which way does the mandible grow? The mandible grows upward and backward. Okay, this is right out of dental school. Okay, so when the mandible doesn't grow, when the maxilla doesn't grow, the mandible gets trapped. But the mandible is still growing. The mandible has to grow upward and backward. If it grows upward, it's going to compress or irritate what nerve? The auriculotemporal nerve. The auriculotemporal nerve is the trigeminal nerve. What nerve? Here you see on the bottom one, it compresses that nerve. Here's an MRI of a young person who had Tourette syndrome. Okay, you can see the condyle is distalized. I don't have a thing here. I'd show you, but as we move his jaw downward and forward, it causes a space to be shown, and that's where the auriculotemporal nerve comes through. And as it comes through, it is not now being irritated. Therefore, if you remove the irritation, it can decrease those symptoms. Irritation of the trigeminal nerve causes input into the brainstem, which interacts with cranial nerves 7, 9, 10, the C1, C2, C3, the reticular formation, and the cerebellum, and the thalamus. In school, we only learn about the thalamus. We don't learn about the cerebellum. We don't learn about the reticular formation. We don't learn about C1, C2, C3. We don't learn about the facial nerve, the glossopharyngeal, and the vagus nerve interacting with the trigeminal nerve. We don't learn about that. That's because we didn't question. We didn't know any better. Wish I had a better picture, but this shows actually how the trigeminal nerve interacts with all those nerves. Tics are possibly due to an interaction of these nerves. Cranial nerve 7, which is the facial nerve, causes blinking and tics and facial grimacing. 9, coughing and spitting tics. 10, the vocal tics and the abdominal tics. The cerebellum causes the head shaking. Correction of the craniofacial anomaly, decompressing the auriculotemporal nerve, allows the irritation to discontinue, therefore reducing and or eliminating the tic disorder or Tourette syndrome. Here are a couple of cases. JG, we did, now what I do is I deputize the parents, okay? So I say, okay, parents, I'm going to let you raise your right hand. They raise their right hand. I say, now you're a doctor. Okay? Easiest way to get them to be a doctor. I leave the room because I'm wearing a white coat. Okay? Kids, especially young kids, they try to hold things back. They try to hold their ticks back because I'm wearing the white coat. So I actually leave the room. I leave the room. I say, for 3 minutes, I want you parents just to count the number of ticks for 3 minutes. I don't care what kind of ticks, you just count them. Count them, okay? So these numbers you see are not my numbers. These are the parents' numbers, okay? JG counted 105 ticks in 3 minutes, and after we decompressed the nerve, went down to 4 in 3 minutes. BH went from 15 to 2. DH, 58 to 15. HL, 60 down to 2. So we did, my colleague, who's not here anymore, Dr. Stack and I, great man, we did 91 cases. We did what is called the Yale Global Tick Severity Scale. And this is what we found, that the simple ticks, remember that list I showed you, reduced by 87%. Complex ticks reduced by 82%. And the internal ticks, that means the abdominal ticks, reduced by 95%. And these are numbers from the parents themselves and the kids themselves. You can't beat those numbers. Not with a drug that gives you all these side effects. And it's all without medication. Video confirmation. All right, I'm gonna skip some of these so that I can show you how this is done. Works for, okay, the first one, Caucasian. Next one, Asian. She's from Japan. She flew all the way from Japan because I went to a conference in 2015, and the mother says, you can get rid of Tourette's. Yeah. You can get rid of Tourette's. Yeah. You can get rid of Tourette's. Yeah. Went and got her husband. You can get rid of Tourette's. Yeah. You can get rid of, now he's a psychiatrist, okay? You can get rid of, yeah. All right. We're going to send our daughter to you. Sent his daughter. This is the daughter. Came from Japan to Maryland. And we reduced her ticks almost to zero. Almost to zero. And she had one of the loudest screaming ticks that you ever heard, blood curdling, just, ah! Now imagine being on a plane 14 hours listening to that. Okay? Yeah, right. But she was a champ. And we got her ticks down to almost zero. So the father, who was, like I said, a psychiatrist, flew me over to the dental school in Japan. And he wanted me to show those in the dental school how it worked. We got the results. And the results were we got 5 out of 5, they had five cases, 7 of them went almost totally gone. The other 2, one kid lost all his teeth. I was like, I can't do anything with that. And the other one actually had teeth extracted. Couldn't do anything with that.
This is my daughter, Nonoka.
Then we had an African American.
Hello, my name is Lamar Hayward. I have
He's from the Ukraine. Okay? So there's one thing that every single person has. Remember I told you that they had that Slick Track 1, they spent $80 million? It was only in one family. They had 8 people who had Tourette's. So they said, we found the gene. It's only in one family. It was never found in any other family. So what is it that everybody has that happens at age 5, 6, 7, 8, 9, 10? Huh? First molars are up, yes. But what does every person have? Are you the same height you were when you were a 5-year-old? So what happened? Huh? You grow. Every single person grows. Didn't I show you the picture of the mandible? It grew. And if it grows, what happens? If the maxilla doesn't grow, then the mandible is trapped, but it's still growing. Which way can it grow now? Backward. Backward causes irritation of the auriculotemporal nerve. Auriculotemporal nerve causes the tics to occur, and I'll show you that in a second. So why are boys affected 5 times more than girls? Because boys do what? Grow more. There you go. Somebody's paying attention. Boys grow more. If they grow more, you're going to have greater irritation. So therefore, 5 times as much as girls. Non-Hispanic white versus Hispanic and black people. Why would you have more less Hispanic people and less Tourette's in Hispanic people and in black people than in Caucasian? How do Caucasians grow? Like this. How do blacks and Hispanic grow? Like this. They have what is called a bimaxillary protrusion. So the jaw has an easier way of growing versus Caucasian, which has a mesencephalic growth pattern. As you can see, I wanted to use a couple people you recognized. Twin studies. Why is there a higher incidence of Tourette syndrome in twins than in non-identical twins? Twins are monozygotic versus bizygotic. 2 different eggs, 2 different people. 1 egg split in 2, same person almost. So their growth pattern is going to be just about the same. So in 88% of identical twins, they both have Tourette syndrome versus 20% of non-identical twins. Twins, non-identical twins. Why is the genetic factor SlickTrack1 and all the other ones doesn't work? Because you find it only in one family, one set of people. You don't find that you don't find SlickTrack1 in Asians. You don't find SlickTrack1 in those of African descent. You don't find it in South Americans. You don't find that. They could have gave me the $80 million. I've been happy to tell them this a long time ago. These are some of the neurobehavioral problems: depression, anxiety, speech problems, learning disability. Learning disability is mainly just because if you have a tic, if you have a blinking tic, you lose your place when you're reading. So therefore, what happens? You got to read it over again, and you got to read it over again, and you got to read it over again. So that's what happens. It's not that they have a learning disability. It is because the tics cause the problem to occur. Attention and hyperactive disorder, writing and arithmetics problems, obsessive compulsive disorders, intrusive thoughts, worries, and repetitive behaviors. And this is, the other portion is the reticular formation. Involuntary movements come from the reticular formation, which is right at the spinal cord level, top of the spinal cord, which is shoulder shrugging, eye rolling. Look at when this was written. This was 1953. Yet, they want to tell you that, oh, it's all in the brain. All in the brain. The imbalance the serotonin imbalance in the reticular formation can cause OCD and ADHD. Head shaking, that's from the cerebellum. You ever see the horse always shaking their head? That's from the trigeminal nerve irritating the cerebellum. So correction of the pathway of the craniofacial anomaly, decompressing the nerve causes the tics or Tourette syndrome to decrease. The same nerve is in a sneeze. Okay? Let's look at the symptoms of a sneeze. Okay? Same thing. And then we'll compare it to the trigeminal nerve irritation of the auriculotemporal nerve. When you sneeze, first thing you got to do, you have to do it, is you blink. Now everybody here is gonna try and sneeze and try and keep their eyes open. You know how stupid you're gonna look. Okay? All right? You facial grimace. You make a facial grimace when you sneeze. You have a head shake, right? You have shoulder shrugging. Vocalizations. You cannot have Tourette syndrome or cannot be diagnosed with Tourette syndrome unless you have a vocal sound for over a year. And then a premonitory urge. When you sneeze, where do you go? Ah, ah, ah. Right? Premonitory urge. Same thing, except it's in a different spot. Sleep disorders in 80% of Tourette syndrome cases. Why? Because you have a retrognathic mandible. Cut off the air. Decrease oxygen. Open the airway. Better oxygen. Better sleep. And that was articles written in '87. Now, let me teach you how this is going to go. This is my questionnaire for my parents. Okay, I give them the questionnaire, and then I want them to show me where all the problems are. Okay, questionnaire, and then I do the examination. We look at the evaluation of the bite, skeletal midline, overbite, overjet, facial balance, missing teeth, palatal vault, very important right there. Tongue position, airway insufficiency. Airway, look at this airway. This was on one of the orthodontic magazines. I was like, this is good orthodontics? Look at that airway. That person is half dead. You listen for the TMJ sounds. If there's a clicking, a popping, grating, pain, a limited opening, deviation, you take good notes. You must take good notes. Okay? Maximum. Now this is the way I do it. Well, kind of the way I do it. I make them shorter now. I don't use a tongue depressor. Now, clonidine, Haldol, all these medications cost money. Okay? Anywhere from $39 to $169, I think it was. I use tongue depressors. Okay? Those are 5 cents a piece. Which would you rather do? 5 cents or $169? How many want the $169? 5 cents. Yeah, I figured that. But I usually shorten them up and I put them against the posterior molars. Okay? And then I do one. Like I said, I have the parents count the number of ticks. And then what I do is I put in the tongue depressor. I put them in at the very back molars. I cut them short enough so that they cover the back molars. And then I do, we get a baseline, find out how many ticks. Like I said, 105 first. Then I put one tongue depressor in, see how much they decrease. Go away for 3 minutes, see how much they decrease. Put 3 in, see how much they decrease. Put 2 in, how much they decrease. So I'm up to 5 right now. I put in maybe one more. How much did they decrease? You can go from the parents are tracking these numbers. This way they can see it for themselves that I'm not lying. That their child can get from all these numbers of ticks down to almost 0. And on their count, not on my count, on their count. Okay? And that's when we, when the parents see that, they start crying and boo-hooing, and we could have done this a long time ago. Just give them 5 tongue depressors. Honestly, when I was studying this, right, somebody put online the best time he'd ever had was at the dentist office. He was getting a root canal. What happens when you get a root canal? Your mouth is wide open. He said he slept like a baby. And as soon as the dentist was finished, closed his mouth and boom, 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 boom. All the tics came right back. I said, oh my goodness, don't you people see this? Anyway, you look at the, what's happening with these patients. You look for a crossbite. Okay, now, one of the things that everybody gets in my office, every single patient gets an MRI, because I want to know where everything is. If you take an MRI and you only see, if you only take a CT scan, you only see hard tissue. If you take an MRI, you see, and a CT scan, you see hard tissue and soft tissue. If I only looked at hard tissue, I could put a skeleton like you do in the high schools, and I can say, yeah, that works. That works for me. No, you're made up of more things than that. You have tissue on top of those bones. So we take an impression. I make what is called a modified gelb. I start out with this, and then we utilize a jet acrylic. I use jet acrylic and a monomer and polymer. And I make a kind of a pasty type thing. Put it on top of the modified gelb. Put it in the patient's mouth. And then we take the number of tongue depressors that the parents saw and said he went down to 2. So we take 5, 6, whatever it is. 5 is usually the main number because they didn't grow. We get an impression. And then I put it in the Instapot. I'm not promoting Instapot, but it saves me time. I put this in there for 5 minutes, it hardens up. I don't have to, in the old days you had to have air compressor and blah, 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 and 5 minutes in the Instapot, and I got it nice and shiny. It hardens up. Then we trim it down, and the patient is happy. Then you want to, you tell the parents, you tell the parents that if they're 5 years old, that this is going to continue for a while because we don't know how much he's going to grow. And then, at least they understand. But a teenager, what we do is we make them a bionator. I don't like twin blocks because you lose the amount of space with the twin block appliance. Here's what the bionator looks like. Here it is in this young man here. All right. I want to show you, make sure that you understand that this really does work.
My name is Ernesto Preska. Excuse me. I have Tourette syndrome. And I saw Dr. Sims on his website. And his patients were moving exactly the way, exactly the way I do, with the help of my family. And my family they were thinking, maybe they're actors, maybe those guys on the videos are actors. This is very painful, and there's many sicknesses associated with this. This is not just the only uncomfort. Sweat a lot because I'm constantly working out, you could say.
temporary appliances. Alright. Put the lips together. What do you think? You're up.
My name's Wade. Came up to see Dr. Sims about my Tourette's. I'm 25 now. Symptoms came up around 13 or 14 with the mild facial tics, nothing too severe. My right arm tends to flex and my midriff on the right side tends to flex. We saw a reduction in tics in the office from 77 in 3 minutes to 3 tics in 4 minutes with no vocal tics, which is one of the biggest ones I was trying to get rid of. We're ironing out the last ones, but it seems to be doing everything we'd ever hoped and dreamed for. This was better results than we really expected.
I'm Sam. I've had Tourette syndrome since about, I guess, my whole life, but started developing tics when I was 6. I used to blink. We thought I just had something wrong with my eyes, and my tics have gotten worse pretty much every year since I was 6. And makes me emotional right now, just because I've lived in pain for the last 6 years of my life. But enough.
Yours
Okay.
yours better.
And now with the mouthpiece, it's a little hard to talk, but I have almost no urge to tick. I feel like I can breathe better. And it's just, I haven't felt this way in a long time. Yeah, in my neck I have no urge at all. It used to feel like someone was pushing down on my spine and there wasn't enough room and I needed to like pull it apart, and now it's gone.
Noah started with symptoms around the age of 3. He would tick often, different times throughout the year, progressively got worse. He, at age 11, was officially diagnosed after many doctors, many neurologists, trying to figure out what the problem is. They put him on multiple different medicines, and we didn't like the fact that it would change who he was. Changed his personality, he didn't feel good, and we didn't want to go that route anymore. We took him off of everything, and of course the tics were terrible. And we were told about Dr. Sims, and it has been a miracle. He went from having 70 tics in 3 minutes down to 1. So it has been an answer for us. It's been amazing, and we're grateful.
And we watched some YouTube videos on YouTube of
Many.
Dr. Sims. That's how we decided to come down to this. Basically we're living what we saw in the YouTube videos. It's absolutely true, and it's amazing because it seems so simple that we should have been doing this years ago. It's just something, the simplest thing that Dr. Sims has discovered.
I like how it feels. The way it feels is my favorite part. It eliminates almost all my tics.
You don't feel the need to, right?
There's not really an urge.
This is the calmest I think we've seen him in 13 years.
Hi, my name is Dern, and I have Tourette syndrome. It started showing up when I was 7. But then I got actually diagnosed when I was in Middleton Junior High School at the age of 14. I tried medications. I tried everything. The only thing medication did was make me like a zombie. I tried, different doctors. Nothing. And my condition actually got worse. But got introduced to Dr. Sims, and he sort of kind of helped me. He actually helped me out, and he actually stopped it, figured out a way to stop the condition. Almost stopped it. My checks have gotten better, as you will see later on in the video.
What was one of the things that we noticed?
With the appliance, it seemed like my eyesight gets a little better. And I had the worst case of Tourette's.
How many hospitals and doctors approximately have you seen? Approximately.
Lifetime, like close to 40 doctors.
And their assessment was pretty much the same?
Yes. Dr. Sims, not just in dentistry, but he used them in movement disorders. These two parts. May God bless him and his family and keep him.
Now, I have 3 books out, or I should say I'm an author in at least 3 of these books here. The dental sleep medicine and temporomandibular joint are more towards the dental area. The smile is more toward the layperson's understanding of the different disorders that we as dentists can do. This is me taking my first selfie. You see girlfriend, she was as quiet as a mouse and she was like, "You gotta take a selfie with me." So that was my first selfie. Now, if you want to learn more about this, this is the code that you can actually learn all about the different disorders, the trigeminal nerve, the temporomandibular joint, imaging, how different movement disorders work. That's the, oh, I didn't have the thing on here. It's www.drsimsdds.com. And you have to put in the www, otherwise it's not going to work. www.drsimsdds.com, and it will give you all this information, and you put in this code and you get 10% off. I want to say thank you. God bless you. I want to be in favor with God and with man. Like I said, I'm not going to be doing this forever. I've done it 20 years. But God told me I have to tell you how to do this. And I want you to be able to do this on Monday morning if you choose to. And to me, it's one of the greatest things is changing a life that nobody, or at least the physicians say that there's no cure for. I won't say it's a cure, but it's close, real close, and I like that. Thank you very much.